All right, let's talk about something I think we've all been through. Have you ever left a doctor's office feeling like you just didn't quite get your point across? Or maybe you walked out wondering why your doctor latched onto some little detail that seemed totally random to you? Well, you are definitely not alone. In this explainer, we're going to bridge that communication gap. We'll look at how doctors actually think, what they're trained to listen for, and most importantly, how you can tell your story in a way that truly helps them help you. It's such a common and honestly a super frustrating experience. You live in your body 24/7, right? You know when something's off. But when you try to explain it, the appointment can feel like a blur. It's rushed, the questions seem kind of narrow, and you end up leaving feeling like you weren't really heard or even more confused than when you walked in. Yeah, this thought right here, this is at the absolute heart of the issue. You're worried about one thing, and the doctor is asking questions that seem like they're from left field. It can feel like they're dismissing your concerns, but as we're about to see, there's a very specific reason for it, and understanding that reason is the key to everything.
So, this is the big question, isn't it? What is actually going on in their head while you're trying to describe what you're feeling? It's not some big mystery, it's a process. It's a specific framework they are trained to use, usually under a whole lot of pressure.
You know, the best way to get this is to think of your doctor as a detective. Seriously, when you're telling them your story, they're not just hearing a story, they are listening for clues. Their questions are like a form of triage, designed to sort through all the information really, really fast, identify any immediate dangers, and figure out what to do next, all in a super tight time frame. And the main tool in their detective kit? It's this thing called a differential diagnosis. What that means is, from the second you start talking, they are mentally building a list of what could be going on. If you say chest pain, their brain just instantly fills up a list. Could be muscle strain, could be acid reflux, maybe anxiety. But it could also be a heart attack or a blood clot. And this checklist shows you exactly what their priority is. Just look at step one, rule out the most dangerous possibilities first. This is precisely why they might interrupt you or ask a seemingly random question. They're not trying to be rude or shut you down. They're navigating a decision tree in their head, and their first job is to make sure you're not on a branch that leads to immediate danger. A massive part of medical school is just dedicated to pattern recognition. Doctors spend years learning to connect these constellations of symptoms to specific conditions. So they're listening for the timing, what the pain feels like, what makes it better or worse, all to see if it fits a recognizable pattern they've seen hundreds of times before. And this is crucial. There are certain clues, red flags, that will instantly change the entire direction of the conversation. So while you might be focused on one thing, if you happen to mention one of these, even just in passing, your doctor's mental alarm bells start blaring. These are all symptoms that are linked to really serious diseases, and they have to check those out first. Okay, so we've got the doctor's mindset down. But here's the thing. It's not just about the doctor. They're working inside a system that has its own set of intense pressures and rules that totally affect every single appointment. Just think about this number for a second. 15 minutes. That is often the entire time slot for a regular doctor's visit. In that little window, your doctor has to catch up on your history, listen to you, do an exam, document every single thing for legal and insurance reasons, order tests or medicine, and then explain the plan to you. It's an incredible time crunch, which makes getting straight to the point so important. And what about that computer screen, the one that sometimes feels like it's getting way more attention than you are? It's a common frustration for sure, but what looks like impersonal typing is actually the doctor carefully documenting your clues in your medical record. And all that clicking through boxes? A lot of times they're responding to mandatory safety alerts about drug interactions or other checks required by the system. Okay, so we get it. The doctor's a detective and they're under a ton of pressure from the system. So what can you do about it? Well, this is the most important part. We're going to talk about a practical strategy that empowers you to communicate in a way that works with their process, not against it. This right here, this is gold. The best thing you can do is present your symptoms in a clear, linear way. This structure gives the doctor the exact clues they need in the order they need them. Start with your number one concern. Then tell them when it started, what it feels like, where it's located, what makes it better or worse, any other symptoms that are tagging along, and finally, why you're concerned about it now. This lets them build that list of possibilities accurately and, just as important, quickly. And just as important is what to try and avoid. Jumping all over the place with your story makes it so much harder for the doctor to find that pattern they're looking for. And try not to lead with what you think it is from your internet search. Lead with your actual experience.
And please don't hold back on symptoms because they feel embarrassing or small. Every little detail could be that one critical clue they need.
At the end of the day, it's all about remembering that you and your doctor are on the same team. You're both working toward the exact same goal, figuring out what's wrong and getting you back to feeling better. You're just coming at that goal from two very different perspectives. And this really sums it all up, doesn't it? You experience your symptoms through a lens of fear, uncertainty, and how it's disrupting your life story. Your doctor is trained to see those exact same symptoms through a lens of probabilities, patterns, potential dangers, and clues. When you can get these two worlds to line up through clear communication, well, that's when the magic happens. That's when you get the best care. So what's the big takeaway here? It's that your story, your personal experience in your own body, is the single most important piece of data in the whole diagnostic puzzle, period. By understanding how your doctor listens, you can learn to tell that story clearly and effectively. You can become an active partner in your own health. So the question to leave you with is, how are you going to tell your story at your next appointment?